So I'm Stephen Duckett. I'm Director of the Health Program at the Grattan Institute here in Melbourne. And last year I was commissioned by the Department of Health and Human Services to do a review of safety and quality in Victorian hospitals, both public and private. And that report was released by the government late last year, and I was here to talk to about that report and what was in it and why we said what we said. Culture is indeed quite a complex issue, and it's got no single answer. And there are many lenses that boards should be using to look at culture. They should be looking at the attitudes of staff, asking standardised questions about the safety culture in the hospital and monitoring how that is going and monitoring how it is compared to other hospitals. They should be making their own judgments about to what extent is the executive of the health service embracing learning from safety incidents, for example, and to what extent is the hospital in denial about that? To what extent are things being surfaced? They can also look at the processes, the clinical governance processes. Is there activism in those processes? Do people seriously participate, or is it something that is perfunctory and the attendance is low? So there are both quantitative measures that can be used to measure culture and also qualitative assessments, walking around and quizzing and observing and so on. So it's multiple aspects of culture, and there are multiple answers.